Hi, I'm Dr. Mark Rosenberg, and since you're watching this video, most likely either you or a loved one has recently been diagnosed with cancer. And now you're searching. What is the best way to treat this particular cancer? Well, I'll tell you what I tell all of my patients. Do your own homework and don't just put all of your faith in your physician, regardless of the fact that your physician probably has your best intentions in mind. And the reason is that most physicians are traditionally trained, and what they've learned is that cancer can be treated only through three modalities, and that's through surgical resection, chemotherapy, and/or radiation. And the truth is, if you have a solid tumor that is localized, that has not spread, very often using these techniques, either just surgery alone or using surgery in combination with chemotherapy and/or radiation, it's very often curative. But what if the cancer spread? What if it's metastatic disease? Unfortunately, if it's metastatic disease, the prognosis is grim. Even with our new targeted chemotherapies, we've minimally increased survival over the past 20 years. There was a large meta-analysis that was published in the British journal Clinical Oncology in December 2004, and it was entitled "The Contribution of Cytotoxic Chemotherapy to 5-Year Survival in Adult Malignancies." And what this study did is it looked at all randomized clinical trials between 1990 and 2004 in Australia and the United States that claimed to increase survival or 5-year survival using chemotherapy. And this is what they found. The increased survival in Australia was 2.3%, while it was 2.1% in the United States. And unfortunately, for most solid tumors, for most cancers, the increased survival over the past 20 years has amounted to about another 2 months lifespan. So what's the answer? If you have metastatic cancer, how should your cancer be treated? Well, as a cancer researcher, I've discovered some interesting facts. The primary concept of cancer growth is the following. Cancer grows through so many different mechanisms. It uses multiple different inflammatory cytokines, growth factors, DNA mutations, hormones, receptors. So many factors go into causing cancers to progress. And the problem is, chemotherapy can affect 1, 2, or even 3 pathways of growth, leaving the cancer many other alternatives to progress. Using older chemotherapy, which is still around today, typically affects the rapidly dividing cells. So it may affect or kill some of the cancer that's rapidly dividing, but it'll leave the cells that are not rapidly dividing untouched. Some of the newer targeted chemotherapies will affect a single receptor. Once again, chemotherapy plays a role, but in and of itself, it's not curative for metastatic disease. Now, I'm not saying that chemotherapy should never be used for metastatic cancer. What I am saying is that for metastatic cancer, chemotherapy alone is simply not enough. It's not enough to be curative or even maintain remission generally. And once again, the reason is we've got to block as many pathways of growth as possible, and chemotherapy alone can't do that. So what we must do is we must use an integrative approach. And when I say an integrative approach, we have to use many different drugs, both intravenous and injectable. We've got to use oral drugs, and we've got to use supplements. And once again, the goal being to cut off as many pathways of growth as possible. There's a paradigm shift that's floating around with many of the cancer researchers. And that paradigm shift is approaching cancer as a chronic disease. In other words, we can take an acutely progressive terminal illness and convert it into a chronic disease. But to do this, we've got to use a comprehensive approach. To learn more about what we do at the Institute for Healthy Aging, please review our website, and if you have any questions, feel free to contact us. Thank you.